Hey, hi everyone. Thank you for reading the title because we tried to shorten it, but we didn't, so we didn't do it. Dear fellow colleagues, I'm Dr. Baptiste Chauvin from Normandy, and I'm very proud to present for you today the results of a study conducted by my former student Aurélien Letellier, who works in Rouen, in Normandy too. I have no conflict of interest for this presentation. We already said that, but as you may know, POCUS and ultrasonography in general practice is increasing constantly in our daily practice. And in 2024, WONCA Europe supported the development of ultrasonography in a position paper, but warned about the risks of overdiagnosis or missed diagnosis due to poor understanding of its use. So the lack of standardized training raised concerns. As you will see right after, we used Osau's criteria for the choice for articles, and you can read it. There are 7 criteria for these criteria. To encourage the creation of an ultrasound training module during the general practice residency in France, it was proposed to conduct a scoping review on ultrasound training methods internationally during medical school and residency. And to include articles, we used the following inclusion criteria. Regarding the results, 2,767 articles were analyzed and only 56 were ultimately included. Some studies offered training that covered multiple indications simultaneously, and it explains the discrepancy between the total number of studies and those categorized by specific indication. If you count, that's not 56. Regarding the proposed training modalities, short training programs were identified, with some lasting only a few hours, depending on the indication. A significant emphasis was placed on prior self-training, either through reading articles or accessing an online database. This allowed for an initial introduction to theory before in-person sessions, increasing the time dedicated to hands-on practice. Blended learning, combining theory and practice, was favored by almost all included studies. In-person sessions were shown to be effectively conducted by either academic instructors or trained peers. These sessions were primarily conducted in small groups with a tutor-to-learner ratio to 1:4 or 1:5 to facilitate quick and fluid exchanges. And finally, concurrent training across multiple indications such as abdominal, pelvic, lung, gynecological ultrasound appeared feasible. In addition to these approaches, the use of simulator while developing obstetric gynecology and cutaneous examination provided a calm and controlled learning environment, particularly for invasive procedures such as endovaginal ultrasound. Simulators offered satisfactory knowledge improvement and an ethical benefit by reducing patient discomfort in certain cases. Based on these findings, we propose a training module during GP residency consisting of, first of all, an initial training for student tutors, peers, followed by 2 training sessions during the GP residency prior to the emergency and gynecology obstetrics semesters. And then for the residents, a self-learning e-learning component supplemented by hands-on practice in peer-led workshops under expert supervision for each emergency and gynecological clinical rotation. And finally, guided practice directly in the clinical departments to reinforce skills. Because we want to do things good. Aurélien updated his review and added 10 relevant studies, and you can see that there are some really good stuff since the study. So, in conclusion, based on the analyzed articles, it appeared that ultrasound training in general practice is feasible and can be integrated during residency, with promising future prospects due to the development of new initiatives, such as the French National Society of Ultrasound in General Medicine. And thank you for your attention.